Cleanliness should be the last thing on your mind when you or a loved one is ill. KMIR-6 recently uncovered concerns about unsanitary conditions at one local hospital. KMIR-6's Adrianna Weingold joins us now with the results of her investigation and what she found inside JFK Hospital. Adrianna.
Your calls and emails are alarming. Accusations of dirt and hair, even used bandages on the floor. Major concerns that could spell unsanitary conditions that many of you worry could also spread disease. It's the dirty truth at one local hospital, and patients have the video and pictures to prove it.
Okay, this is the bathroom. And nobody has been in to clean or sanitize this toilet.
This is video taken inside a patient's room at JFK Hospital in Indio. Hair and dirt is caked on the floors. There's even a used Band-Aid next to the toilet. Hardly the conditions and cleanliness expected at a hospital. But this is exactly what the Gomez family endured during their 5-night stay at JFK.
It is dirty, very dirty.
Joyce's 74-year-old husband, Eddie, was rushed to JFK Hospital last month with a 104-degree fever. He was admitted with a bronchial infection to a room that looks more like a breeding ground for bacteria than a safe place to recover.
In my heart, I believe that that room had never been cleaned from the patient before us until they moved us in there. Because there were Band-Aids on the floor that didn't belong to us. The toilet was filthy. There were spider webs on the wall. There was a spider on the wall. There was lint underneath the furniture, underneath the bed. The tables were dusty, dirty.
You can see trash, the dirt and debris in the corner of the room.
It was my dad that was sick, and just looking at the conditions of the room and, wondering, how long had it been this way, because it was obvious that this just wasn't like a day that they didn't take the time to wipe things down. What we saw was it took time for it to get that way.
Hospital staff say the rooms are supposed to be cleaned and sanitized after each patient, but these pictures suggest otherwise.
If they're not sanitizing the rooms in between patients, then that would seem like, you would be layering sickness over sickness, germs over germs.
This is the floor as you're going into the bathroom. You can see all that dust and grime and buildup in the corner.
Eddie stayed in the hospital from January 2nd through the 7th, first in the carry-on suite, but after the bathroom flooded, he was moved to the Ryan suite, where these pictures were taken.
Nobody should be in those conditions when they're sick.
I don't know who's been in this room. I don't know how long this filth has been in here. And of course, I wanted him to get well. We wanted to get out of there. And I just felt that it was very unsanitary, very unsanitary.
JFK Hospital is highly regulated by the health department and a healthcare accreditation group called the Joint Commission. The hospital is subject to both planned and random visits. It also goes through an accreditation process every 3 years. JFK was recently accredited by the Joint Commission. Now, they're one of the agencies that control patient care, quality of care, and also cleanliness. One of the interesting things in this survey, though, is that 17% of patients say that their room was never clean or almost never clean. That's twice the national average. Stephen Davidson is the Director of Environmental Services at the hospital. We showed him pictures from inside the Gomez's room.
There are Band-Aids next to the toilet, dirt and hair on the floor, gum in the track. Can you respond to these photos?
Sure. I mean, that room was not ready for a patient admit. And whether, that patient was admitted prior to us being able to clean it or after we cleaned it, it's unacceptable.
The Gomez family isn't the first to complain about filth. Officials at JFK tell me another patient recently complained about cleanliness in the emergency room. That complaint prompted a visit from the health department.
I'm apologetic that they were admitted to that room. I personally feel horrible. If my wife or child was admitted to that room, I'd be disappointed. But that's not our standard. It wasn't met, and we've used this to train staff and assure that these types of instances don't continue to occur.
In the Gomez's case, Davidson says the staff member assigned to clean the room didn't follow proper procedures, including thoroughly cleaning and disinfecting the entire room.
We were obviously aware of these unfortunate circumstances. Our EVS team responded appropriately, other than a staff member not following our appropriate protocol in cleaning contact surfaces in a patient room.
Bridget Davila is the infection preventionist at JFK. It's her job to prevent the spread of infection. She says the room may have been dirty, but the patient's safety was never in jeopardy.
The room appearance was not to our standards. I want to say that the patient care was not compromised in this patient's stay. We apologize for their experience here at JFK.
This dirt and some kind of sticky stain underneath the coffee table.
Since our investigation began, the rooms have been thoroughly cleaned. Blinds have been replaced, and they even installed a new flat-screen TV in the Ryan suite. But for the Gomez family, the damage is done. They say the only way they're going back to JFK is in an ambulance. We should point out the administration at JFK Hospital was very apologetic about the conditions of the Gomez's room. The hospital was cooperative and very quickly responded to our inquiries. We were allowed in last week to see the current conditions for ourselves, and I must say the room we were shown and the halls we walked down looked spotless. Back to you.